Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare. Hello all, this is Dr. Molly Hart and Dr. Katie Schubert here with another episode of Sex on the Floor podcast. So today we have a fun little treat and we are going to be talking about something called overactive bladder. This is something that I treat a lot of, and Dr. Katie this time is going to be here for fun commentary.
That's right. Asking all the questions that people would ask without knowing the information that Molly knows.
So what do you think overactive bladder means when you hear that? What does that tell you?
It sounds to me like someone who has the urge to urinate a lot or does urinate a lot.
Yeah, exactly. So overactive bladder is somebody who feels a strong sense of urgency very often to go to the bathroom. So let's talk about normal bladder. Normal bladder, you should be going pee every 2 to 4 hours. Now, some people, like our teachers, our nurses, our military, our police officers, they hold their bladder all day. They don't have time to even have the ability to take care of basic needs like go pee. And so they hold their bladder all day long. Interestingly enough, they can actually end up developing overactive bladder because of that. But those individuals aren't going pee very often. And then you've got most people in society going pee every 2 to 4 hours. And then you've got your overactive bladder individuals who are going pee more often than every 2 hours. And that's somebody who's going to come and work with me and see me. So let me give you an example of, I'm going to give you 3 examples of people who have overactive bladder. Recently, I treated a 24-year-old male who has had overactive bladder his entire life. He had something at birth occur. I can't remember exactly what it was. So this has been something he's been dealing with for a very long time. He was going pee every 30 minutes. He was peeing the bed at nighttime. When he drank alcohol, alcohol really pisses the bladder off. It would get really bad and he would pee himself. So he would go out with his friends on like a Friday night, Saturday night, and then have to go to the bathroom nonstop, right? When he's hanging out with his friends, which people are going to notice. You're 24, that's not normal. And then he would often, like I said, pee himself on the way to the bathroom. And so he'd have to wear pads when he went out with his friends, 24 years old. So this is not something that just affects old people. This is like something that affects people of all ages. Overactive bladder is something I see often women in their 30s. These are going to be women who also deal with pain with sex. So these are women who have a lot of high anxiety, high stress, and they've got a lot of tension in the pelvic floor muscles. They're typically going to say, yeah, I deal with a lot of bladder urgency issues, and I have pain with intercourse with deeper penetration. You're going to see that correlation because the bladder sits at the back end of the vaginal canal. So it makes total sense. The other group of people you're going to see with overactive bladder are going to be our women who are now in like perimenopause to menopause age. And so perimenopause starts around age 45. What does that mean? What does perimenopause mean? Because nobody talks about it. Perimenopause is when your estrogen and your progesterone, which are 2 very, very important hormones for us women, they start to go a little haywire. They start to go up and down, but not in response to your menstrual cycle. So we know estrogen and progesterone go up and down in a very structured way, depending on where you are at on your menstrual cycle. But in perimenopause, they just start kind of doing their own thing. And this creates a lot of symptoms in women, and women don't even realize it's because of the hormonal shifts. And they go to the doctors, and the doctors literally give them no education. They say they don't know what's wrong, and send them on their way. And what's going on, your sleep issues, your massive and insane anxiety that just started occurring out of nowhere, your hot flashes, your night sweats, your skin changes. There's so many things that start to occur. A lot of it is hormone related. So we know estrogen specifically is incredibly tied to serotonin, and serotonin is one of our feel-good hormones, right? So that's why anxiety we can see start to really spike up, and these intensive mood swings start to occur. We also know that estrogen is super tied to our insulin sensitivity. And so during perimenopause, we also are going to see a lot of weight change. And typically we're going to start to gain weight. The body is really good at that time at storing fat, but not getting rid of fat. And so we start to see these weird changes start to occur. And another thing that happens is people can start to develop pain with intercourse and bladder issues out of nowhere. They're like, why did this happen? Now, normally those women that are in perimenopause, menopause age that start to develop bladder issues, normally, but not always, they have had a past history of multiple vaginal births, vaginal, maybe even a C-section birth. It's not, I don't see it as often if these women have never had children, that the bladder then starts to get affected with it. So anyways, those are, go on. Yeah, sorry.
I want to ask you a question about the first thing that you were talking about. So with the exception, so not considering the perimenopausal, menopausal
Yeah.
women. So let's just say that you are a female or a male with an overactive bladder, and it's not tied to menopause of any sort.
Yeah, no hormonal issues that are a factor in it.
So when you feel the urge to go pee and then you do pee, are you peeing a lot, or is it more like you pee a little bit, like more of like a bladder infection type of pee where you just like get a trickle?
Oh yeah, good question. As you're saying that too, another group of people in here is going to be people who get chronic UTIs. Chronic UTIs, BV yeast, they're going to also develop overactive bladder. So it depends. So every person who presents with overactive bladder is so different in how they present. And if you're watching this, you're going to see me smiling right now because I find it so freaking fun. I'm like come in here and I'm asking all these questions, and I ask questions that nobody has asked these people. Like I get so detailed with what's happening with their bladder life. And it's always a different puzzle for every single person. And depending on that puzzle is how I'm going to structure their entire plan of care, because there's a lot of ways in which I'm going to address these bladder issues. So some people have an insane amount of urgency, but they're only, and when I say insane, the intensity of it is high. So like when you feel like you have to go pee, it's not an anxiety provoking thing. You're just like, oh, I got to go pee. The bladder is not on your awareness. Correct? Their bladder is on their awareness 24/7. Anywhere these people go, they are checking out where's the bathroom before they leave. Anywhere they're going to the bathroom. If they have a route to go drop their kids off at school, they know every single clean bathroom along the way. Like that's how much because they don't trust the bladder, and the opposite of trust is anxiety, right? So so the intensity of the urgency is a factor, and that intensity varies depending on people. The timing is a factor. Some people are going every 20 minutes. Some people are only going every 2 hours, but they're having a high intensity and they're leaking, right? So it's still a problem. Some people leak, some people don't leak. What you'll find with that is people who are really hypertonic, like my girls who have dyspareunia, they're typically not leaking because they're so restricted that, yeah, they have intense urgency, but they're able to hold it. Did that answer what you were asking?
Yeah. I mean, I think the interesting thing to me, so as everybody knows, I'm a therapist, right? So I see clients and the sessions are 50 minutes. I have a 10-minute break and then another 50 minutes of clients. So I am peeing every 50 minutes on the dot throughout the day, but I'm peeing a lot because I'm sitting there and I'm drinking a lot of water, right? So I sit, I drink, I pee. I sit, I drink, I pee. Like that's the thing.
Do you have to go pee every 15 minutes, or do you do that as like a just in case pee?
It's usually usually I have to pee a little bit and I'm like, oh, do I really want to hold it for the next hour? And usually the answer is no.
Okay.
But I fill up my 40-liter like hydro flask and I drink like 3 or 4 throughout the day. So I mean, I think that the interesting thing is that like you also probably need to keep in consideration your water consumption.
Water consumption is, so let's talk about water consumption. So that's why I say there's like a puzzle of questions. So I'm always asking, how much water are you drinking? So I've got some come in and they're not drinking any water because they're doing that as a way to behaviorally manage the bladder. And that actually, believe it or not, will make the bladder worse. And so I'm like, we need to bump up your water intake because I don't even have an accurate understanding of how often you're going to go pee if you were taking in a proper amount of water. And then I have some people who say exactly what you just said, and they're like, oh, but I drink a lot of water. That's why I go. And I'm like, okay, well, how much water do you drink? And so I'm a big fan. We actually have a research-based blog article on our website if you want to look at exact water intake for your body weight. But a general rule of thumb, if I'm going to just simplify it, is half of your body weight in fluid ounces. So like I weigh 180 pounds. So I should be drinking, how much should I be drinking? What's half of that? 50, like 90 fluid ounces. So, and what'd you say?
I'm not a mathematician, clearly.
Yeah.
I got it wrong.
Did I even get it right? I don't know. Yeah,
You did. You're good.
I'm like, so, and I do, for the most part, I do drink that. Now, when you're drinking proper water intake for your body, you are still not going to go more than 2 to 4 hours. In fact, you're going to go a little bit closer to that 2 to 3 hour time frame for a healthy bladder. So if you're drinking proper fluid going every hour, that's still actually very frequent, but that's because it's a just in case pee. And so when we train, it's so cool about the bladder. People don't realize this. You're familiar with Pavlov's dog experiment, classical conditioning. And so salivation is an autonomic nervous system thing. I'm not like, hey, body salivate, and my body salivates. But he was able to ring a bell and get dogs to salivate just with the bell ringing. Because they were anticipating food coming. And so the bladder is so cool because we can train it that finite. And then we can also extinguish a behavior. So what's interesting about the bladder, I don't know how up to date this is, but I'm going to give you some information that I learned back in my American Physical Therapy courses back in 2017 timeframe. So I don't know if additional new research has come out, but what the research said is that the bladder is going to give you a signal that I have to pee. The bladder is sending the message to the spinal cord sends it to the brain around 30% full. And most of us just ignore that. Like we're busy, we just not even paying attention to it. It's going to do it again around 60% full. In that case, if you're like Katie and you're like, I have another appointment coming up, that's where some people might be like, it's like you purposely checked in with the bladder, right? And you're like, it's a little bit full. And then you're going to go do that just in case pee. Well, when you do that, you're now training the bladder to go pee when it's only 60% full. Most of us ignore that. And then 90% full, it's going to send another message, not intense. It is not an intense message. It's just a message of, hey, I have to go pee. And most of us then are going to be like, okay, I'm going to wrap up what I'm doing and find a bathroom. Still super calm, not in any way, shape, or form a panic that's occurring. But we can train our bladder to start to really have an intense urgency to go to the bathroom at 30% or 60% full. And so those just in case pees, I'm huge on like, don't do that. Don't do it.
Okay.
I want you to like actually let the bladder fully expand. And then we know too, the detrusor muscle around the bladder, it's going to work its best if it's got some stretch on it so that way it can actually contract. So if we're trying to, a lot of these women that are coming to see me and men, they feel such strong need to go pee and they go sit down and pee and like 5 seconds worth of pee comes out, 3 seconds worth of pee because they don't actually have to go pee. But the nervous system told the brain it had to go pee. So it's a faulty system happening with the nervous system. That's what overactive bladder is. It is a faulty messaging system that's occurring.
So I have another question.
Yeah, go.
Okay, so most people, well, I'll speak to myself and my husband because I know his pee habits in the evenings and at nighttime. I don't know anybody else's.
I know my husband's too.
But like, so I think that we, like me and my husband pee like a normal, I would say on my non-clinical days, I pee a normal amount that 2 to 4 hours probably.
Right.
So does James. But at nighttime, we can go the whole night without getting up and going pee. So are you saying that even people who are asleep experience this overactive bladder?
Yeah, so unfortunately, overactive bladder, what's going to look like, this is not everybody, but it's so detrimental to their sleep. I have women come in and they're like, I'm waking up 5 times a night. I've had people who are like, I'm waking up 13 times a night to go pee. So what's normal? 1 time a night is normal for most people. And as we get a little older, 2 times a night is considered normal. So if you're waking up to go pee more than twice, you're getting in that abnormal range.
Yeah.
Yeah. So yeah, they cannot sleep. They wake up with intense bladder discomfort and they have to go pee. Yeah.
Wow.
Yeah. So your bladder can hold a lot, right? So the bladder is always filling. People think, oh, if I'm not drinking water, it's not. No. Like your kidneys are always working. They're always filtering your blood. They're always putting water. Sorry.
How much can your bladder hold? Like typically, what's the average?
Oh God, I should know this number, Katie, because they always do it in cc's. And I don't even like understand what cc's even is, and I should. I actually know the answer to that, and I don't, so I'm not going to say it off the top of my head. I should, before I started this episode, I should have looked that up. But there is specific amounts for women and men. It's a little bit different, right? Men are larger. I know I could look it up. And we could say it.
So the average bladder capacity is about 10 to 18 ounces.
Yeah,
so
research should always be in cc's, is how they don't ever say it in ounces.
Henry Ford. It was the first thing that came up on Google. That means your bladder should be able to hold the equivalent of 1 to 2 tall glasses of water.
Yeah, it's a decent amount. So how you know how much your bladder can hold is that first pee in the morning is always going to be your largest pee. And I always have patients for me count in Mississippi seconds how long that takes them. A more accurate way of doing that, and what urologists will do, is they actually have them pee into a container to actually measure how much it is. And there's something called like a bladder diary. So oftentimes some of my patients, depending on who they've seen, have done all of this. Those are mainly my patients with something called interstitial cystitis, or it's called painful bladder syndrome. These people have overactive bladder, but they also have an insane amount of pain in the bladder. I mean, it like destroys their lives. And there's a lot of different thoughts on what's happening with all of that. I treat so many people with painful bladder syndrome with incredible results. So my viewpoint on it is very different than some people's viewpoint on it. A lot of people think it's a bacterial infection that's in the lining of the bladder. And I'm not saying that that's not true. That can be a factor, but there's a lot that we can do to rehab and get people out of this scenario that they're in. So, okay, there's that. Any other questions?
I don't think so. I mean, I think it's important to also say here, because what you're talking about, like waking up like 8 to 13 times a night, like I absolutely did that when I was like 9 months pregnant.
Oh gosh, yeah.
But that doesn't mean overactive bladder. It just means that you have like this tiny little human sitting on your bladder making you pee.
Exactly. You know what's so interesting, Katie, is even when I was super pregnant, I never went pee an insane amount because I know all of this stuff and I know how to control my bladder that well. But my husband, he is in law enforcement and they can't go pee all the time. So they do a lot of just in case pees, and he for sure has a little bit of overactive bladder. And he the whole time I was pregnant was going pee more often than I was. And it was cracking me up because he would have like one alcoholic drink and he'd be like every 30 minutes going, I'm like, you need to come in and get treated. Like, so now it's like a running joke with him and I've learned a lot of law enforcement have bladder issues because of their job, just the way it is. And then women who are in law enforcement, I have had to rehab before because they get C-sections. And then they have this big, massive, heavy belt with all their stuff that's sitting right on the C-section. And the law enforcement is total shit for how they treat women. They don't give them like oh my God, there's like nowhere for them to pump. How are you going to pump for if you have a baby you're trying to breastfeed? You have all this gear on. There's nowhere safe for them to just like take their stuff off and do it. They are so, in my opinion, there needs to be some serious legal reform in law enforcement for women postpartum, because it is the worst thing I've ever seen. Like it makes me so angry. Anyways.
Awful.
Yeah, it's awful. Think about it, when a cop has to go to the bathroom, they have to take off their gun, they have to take off their taser, like they have to go somewhere safe. Like it's a whole
women, right? Like men can just
no, women and men, both.
Oh.
They can't just go to a 7-Eleven bathroom. or like somewhere where there's like a stall. Like, you have to take off all this gear that has
Oh
equipment.
my God.
Like if you think about it, it's a whole ordeal.
Yeah, I never really thought about it.
Yeah. And they're going from call to call to call. Like they don't know what's going to happen. Anyways, so for overactive bladder, those were just some examples of like what's happening with people. I had one woman who she had painful bladder syndrome when she came to see me. And this was when I first started my career. And this one was about to get surgery. There's a surgery they do where they'll implant a sacral stimulator. Because if you stimulate the sacral nerves, you can calm the bladder down. And it was the end of the year. So she's like, I have to get the surgery done before December. And I was starting to work with her, I think in like September. Brand new, like baby PT. And she's a mom. She had it so bad. She had every bathroom mapped out on the way to her kids' school. She would pee in their diapers. She would keep their diapers on hand and sometimes had to pull over and like pee in her kids' diapers because it was that bad. And I said to her, I said, listen, I said, give me 2 months of working with you. I said, and I'm like, I'm going to work so hard to try to get you to cancel the surgery. Like she was young, like she was our age, Katie. Like, I'm like, I do not want you having this device put inside of you. And then she did the trial run and didn't even get any better. And they were like, oh, it's good enough. I think she got like 20% better. And I was like, you're going to have a whole device put inside of you for 20% better. Anyways, she got better. She canceled the surgery. It all worked out. But that's an example of like how extreme this overactive bladder can end up being and affecting people's lives. So what I'm doing is I'm looking at water intake. I'm going to make sure that that's accurate. There's something that I do that's what's called a bladder schedule. And so I have them literally at very specific time intervals of when we're going to go to the bathroom. I base that time off of all the information they've given me. And then I strategically increase that time. That again is this is just experience that I'm able to understand now how to progress that with certain people. So some people I can go up by 30 minutes every week. Some people I can only go up by 15 minutes every 2 weeks. Like how aggressive I can be with the spacing of that is very dependent, and they have to tell me how they're doing. I will never make a progress in time if they have had less than 90% ability to hit that goal. So for instance, if they're going pee every 30 minutes, I'm going to be like, okay, our goal right now is this sounds weird, but here's the goal is I'm trying to allow them to have control again. So if they're going every single 30 minutes because of an urgent message is telling them to go, I'm actually going to start my bladder program below that time frame. And I'm going to say, okay, this sounds crazy, but I'm going to have you go every 20 minutes because what I'm trying to do is prevent that intense panic from happening and give them control again. And we're going to like reset the nervous system. And so let's say we did 20, the next week we did 30, then 40, then 50, and we're slowly trying to get them to a 2+ hour time frame. How long that takes is dependent on the patient. But that's one management. The other thing I'm going to go over with them is something called void suppression techniques. And so I've got 3 different techniques I go over with them of how to use their prefrontal cortex to suppress the message that the sensory cortex is telling them. So the sensory cortex is saying, oh my God, like we have to go pee, let's rush. But they know they don't. They know the bladder is not full. And so we can actually override that if we have some tools in our bucket. And so I go over the nervous system and how to really control that. Another thing I teach them, and this technique works with some people, is you can do Kegels. So actually if you do like 10 quick, I say quick, but kind of slow and rhythmic Kegels, the pelvic floor and the bladder muscle do opposites. So when the bladder is contracting, the pelvic floor is relaxing. And when bladder is filling, the pelvic floor is squeezing to kind of support it, right? So
you're saying if people really have to go pee, one of the and like actual pee, like if I really have to go pee right now, the trick is to do some Kegels and I can put it off for 5 minutes.
Yes, you could. But the only thing is with that technique, I don't like the Kegel technique if you actually have a really full bladder. Because if you have a really full bladder and now I'm squeezing on it with the pelvic floor, it's not going to work very well. That's like a bad technique to use for an actually full bladder. Now, what is really good to use if you really have to go pee is actually just stop what you're doing, sit down, and do 5 very slow rhythmic diaphragmatic breaths. And you're very intense with counting 4 in, 8 out. You do not let the brain at all focus on the message of the urgency, because if you let it focus on there, it's going to skyrocket. You can actually suppress the message to where it turns off for a little bit.
Interesting.
Yeah, super cool. You can do diaphragmatic breathing with that too. This sounds so silly, but if you're feeling really cold, I used to get cold all the time. I used to always have a sweater with me whenever I would go into buildings. And I use these techniques I learned for that. And so anytime I would have goosebumps, if you hyper focus on the fact that you're cold, you'll just stay cold and feeling crappy. But if you stop focusing on that and do diaphragmatic breathing, you can suppress that feeling of cold. You can get rid of the goosebumps. And I was able to use that technique to actually enhance my body's ability to tolerate cold in different buildings. Because I used to, as a PT student, this was at the VA. It was so cold at the VA. It bothered me so much. So I use these techniques to train myself out. So you can do it for a lot of things, not just the bladder, is my point.
Yeah. Any discomfort.
Yeah, any physiological response your body's having that you want to suppress, because like I was just in a building, like it's not actually harming me. That's the biggest thing, is like the bladder is not harming you. This cold isn't harming me. I don't need to be having a physiological response that's telling me to avoid and run away from this. What I need to do is train my body to tolerate this input, because this input is perfectly fine and safe. Yeah. So that's one technique. The other technique for void suppression that works amazing is you can say a mantra in your head or a phrase over and over again. And this is what I use personally. And this works for bladder or bowel, by the way. So if you have a response from food or coffee and you're like, oh my God, I'm about to shit myself, this works. It works really well.
I tell my husband about this one.
But it is mine that I use is very slow and very rhythmic. I am in control. And I just say it in my head over and over. I don't let any other thoughts pop in the mind, just saying, I am in control. And you slowly walk to the bathroom. You slowly open the door. You slowly pull your pants down. You slowly sit down, because if you rush, the bladder won or the bowels won. And if you rush to pull your pants down, you're going to lose control right when you pull the pants down. And they're going to start to pee on their pants or pee on the toilet. So you cannot rush any of it until you're fully sat on the toilet, like ready to release, and then let it fly at that point. So we go over a lot of these different techniques, and everybody's a little bit different. Some people grasp it really quick. Some people, I have to work a lot more to get them to understand how to use these techniques. So that's all great. So these are great ways to get the bladder to the nervous system to be rehabbed to where we want it to be. But if I then don't address the pelvic floor issues and the pelvic health concerns they're having as well, I'm not going to get anywhere. And so what do I mean by that? Because there's a reason why this all happened. It's not like the nervous system and the bladder started acting chaotic for no reason. There's something physiological also going on. And so that's where I typically am going to see an insane amount of, there's two things. There can be a lot of restrictions around the bladder, muscular and connective tissue wise. I'm going to see that with my C-section moms, because when they cut open the uterus, I mean, that bladder is sitting right, the bladder and the uterus are like this. So that scar tissue that forms there can create a lot of restrictions and create a lot of bladder issues. I'm going to see it in people who have a hypertonic pelvic floor from high stress and anxiety. We know, we've talked about this in past episodes, high stress and anxiety, your pelvic floor is just on. It's automatically happening. You're not aware of it, but it is just on and it's staying stuck like that. When the muscle's really restricted like that, you are going to get very poor blood flow to that area. The pelvic floor is super susceptible to poor blood flow. And now I've got less blood flow. I'm not taking away toxins. I'm not bringing in nice nutrients. So now I'm going to create a lot of scar tissue and inflammation. And that, all of those things are going to just piss the nervous system off like no other. The nervous system really loves three things. It really wants space around it. It wants to be able to move freely, like dental floss through your teeth. And it really wants good blood flow. So if I've got a really tight muscle around this nerve and it's not getting any three of those needs met, of course it's hypersensitive and pissed off and constantly sending messages every time the bladder is just a little bit full, because now the bladder is putting more pressure along those nerves and it's not happy about it. It's like, I'm already cramped, I'm already pissed off, and now you're putting more pressure on me. So it wants you to constantly relieve the bladder so you can take pressure off of it.
That makes a lot of sense.
Yeah.
The mantra thing, what you just said about the I am in control. I'm just going to stop as a therapist and say that is a great intervention for almost any anxiety that you have. And as you said, a lot of this is anxiety based, right? It's like they want to relieve it, not only for the physical pressure that you were just talking about, but now because they have a whole lot of anxiety built up around their bladder and urination. So, mantras we use in therapy all of the time because it slows you down. It brings mindfulness to whatever it is you're doing. And it calms whatever's happening.
Yeah. And that's exactly what you need, because you need, when the bladder is starting to give them that message, they are in a panic, because immediately the brain is just thinking, I'm going to pee myself. Like, it goes into that panic mode. They don't trust their bladder anymore. First thing I always tell them is like, I'm going to help you trust your bladder again. And they're like, they can't even believe that. And they like, don't even realize like how much they don't trust the bladder anymore. And how much it's ruling their life. It literally is ruling their life. It's so sad. So no, I love that. So yeah, we use that as, and it's a super effective technique, just like you probably found with whatever it is you're using it for. And it's my favorite go-to technique, by the way. I have used it multiple times.
Yeah.
So we have to get rid of restrictions. That's a lot of the manual work that I'm going to be doing as a physical therapist, externally and internally. I'm doing that. So for men, I'm doing that via the rectum and putting a lot of work through the prostate area, because your prostate is right there on the bladder. And for women, it's going to be a lot of work on the lower abdomen area, and then vaginally at the top area of the vaginal canal. We're doing a lot of manual work, and I'm teaching you guys how to do it all yourself. You're going to go home with a massager. You're going to go home with a pelvic wand, and I'm showing you how to do these techniques, because the body needs small doses frequently in order to get good results. You can't come in once a month, once a week, ever. I don't care how good your PT is. If you're coming in once a week, you will not get better. You need 3 times a week consistency for at least a minimum 6 weeks upwards to like 14 weeks for us to really calm this. The longer it's been going on, the longer it's going to take to rehab it. That's what I've learned with the nervous system, especially. Now, some people don't have any tissue restrictions. I go and I assess them, and there's no tissue restrictions. They just have an insanely hypersensitive nervous system. And that's typically because of a surgery they had. Like, so that's like my post-hysterectomy women. Again, you're going to see this with people who get a lot of chronic UTIs, BV, and yeast infections. So there's no restrictions yet, but because they've had these infections, the nervous system is on high alert, because it's trying to tell you, hey, there's infection here, there's something wrong. And they're typically not getting the infection to go away because they're going to a urologist or a GYN, and urologists and GYN are very non-specific in how they test for infections. It's a very just like simple, basic test. Half the time, my patients aren't even getting a culture back. They're just having it looked at under a microscope, which is crap, by the way, total crap. I'm going to be on here and say that. And so if you're having chronic infections and you're not getting anywhere with the antibiotics that they're giving you, you have to go to an infectious disease doctor. That is what I've learned. I've got some incredible infectious disease doctors that I work with now. They do much more specific tests, and then they will give you the antibiotic that you actually need to get rid of that specific bacteria. And that is like life altering. But just because we get rid of the infection, so that's like a big part of my plan of care, is honestly just advocating for my patients and teaching them how to work the medical system, because they don't know what they're doing. And so then once we actually get the infection to be gone, their bladder or their nerve is still so sensitive. They still have a lot of issues. And they don't understand that. They're like, why, if my infection's gone? Because just because your infection's gone doesn't mean that the nervous system calmed back down. That's what chronic pain is. Chronic pain, and this isn't pain, but it's chronic oversensitivity of the bladder. The nerve didn't get the message. It still thinks there's something wrong. And so that's where PT comes in always, is we're getting their body to like re-regulate itself, essentially. So that's how we're going to be treating overactive bladder. If you come in, there's a lot of manual work, there's a lot of education, a lot of nerve desensitization is what I call it. Bladder schedules, suppressed voiding, so on, increasing water. There's a lot of different habits that I'm going to put together and formulate based on the individual person. And I'm tweaking it every single time I see you on how we're going to progress this.
Oh, it's fascinating.
Yeah. So that's overactive bladder, y'all. Hopefully you're not dealing with it. But if you are, go see a local pelvic floor PT near you so you can get your life back.
That's our slogan for today.
Say that again.
That's our slogan.
Yeah, exactly. Well, thanks all for listening. Next episodes that we're going to be doing for you all, this is really exciting, but we're going to do a communication series. So stay tuned for that. We've got 4 different episodes that we are going to be doing specifically on communication with marriage or couples, correct, Katie?
Relationships, yeah.
Yeah, just with relationships. So stay tuned for that. We'll see you at the next episode. Bye, y'all. We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.